Hi, welcome to the subsequent section on syncope. This is Dr. Jaitly. Like I mentioned, syncope is a transient loss of consciousness as a result of decreased blood flow to the brain. And how does that happen? Well, we talked about the low volume, which is the low blood volume. We talked about severe obstruction within the valve. We talked about the weakened heart, and we talked about the autonomic dysfunction, and we talked about the slow heart rate and a very rapid heart rate. So let's understand first one major cause, and that is low blood volume. What do we understand by that? Well, the causes of low blood volume is whenever there is a blood loss. For instance, say somebody's going for surgery and the surgery requires a lot of blood transfusions or blood loss is anticipated, for instance. So patient can pass out because of blood loss as a result of surgery or post-operative, or sometimes from a bleeding disorder, or say an accident, in a car accident or a train accident, somebody loses a lot of blood. So that can cause syncope or loss of consciousness transiently till the help arrives and the consciousness is again restored once the blood volume is increased either by IV fluids or hydration or blood replacement, ideally blood replacement. Dehydration, well, it has to be a very severe form of dehydration. Say somebody standing in the sun for too long or does not have access to water, like in hot tropical climates. People walk long distances in the fields or in the deserts, etc., and there's no shade. Sometimes even on a beach on a hot, sultry day, if you do not have too much fluids, sometimes the fluids can be wrong. People take wrong fluids in their igloos, and specifically like a lot of caffeine and alcohol, and that could dehydrate you in the summer, and somebody may lose consciousness as a result. Diuretics is another set of drugs which can cause a lot of water loss through your kidneys. So sometimes it's desirable to lose water through the kidneys, like the doctor recommends it, but then many times it has also been seen if the diuretics are being used and the patient is not replenishing water orally, the chances are there will be dehydration, and as a result patient can still pass out and have syncope. Severe heat, we just talked about those mechanisms. And then of course a severe valvular obstruction. What do we understand by that? Remember, the heart is constantly beating, and as it beats, the left ventricle, when it contracts, it sends the blood up the aorta into the brain and to the rest of the body. But if you have a severe valvular obstruction, may it be on the mitral valve or may it be on the aortic valve, that will result into a low blood volume reaching the brain, and as a result a patient can pass out. And that passing out spell, or a transient loss of consciousness with full regain of consciousness after the patient falls down on the ground, is called syncope. Syncope. Hope you learned something more in this section, and as we move forward we'll get more and more intricate, so let's keep the interest going. All right, thank you so much. This is Dr. Jaitly again, and see you again in my next one. Bye.